Well, if you remember, I made my last video a month ago. In fact, it was the day I had my last treatment on the linear accelerator. And I was congratulating myself on how well the whole thing had gone. I'd been through 4 weeks of treatment without being bounced off the machine once. Now, unless you know what that means, for prostate cancer, it's important that your body's in exactly the same position every time you receive the treatment. And that means your bowels have to be empty and your bladder reasonably full. So every day you're having to try and prepare your body. So for example, for the bladder, you drink over 2 litres of water a day, empty your bladder when you arrive at the hospital 30 minutes before the appointment. You drink half a litre of water within 10 minutes, and then for 20 minutes you allow it to filter through. So you have about 260 millilitres of fluid in your bladder when you receive the treatment, and that's just the optimal amount. For your bowels, you want them to be empty. Now, after a few weeks of treatment, you're told one of the most likely effects is going to be diarrhea. And of course, that can be a big problem because you're running for the toilet the whole time. Although it does empty your bowels, so from that point of view, it's good. But funnily enough, I didn't have that. So after 3 weeks, everything was fine, but I was slowly getting constipated. And therefore, for the last week, it was a bit of a struggle trying to empty my bowels. So I'd be straining away for about an hour before my treatment, trying to empty as much as possible. Because if you don't do that, when you're on the machine, they do a CT scan. And if your bowels are too full, they'll bounce you off and you have to try and empty them before you have your treatment. But I went through my whole 4 weeks without that happening. So even on the last treatment, everything was okay within the limits, and I went ahead. So I was congratulating myself that day. In the afternoon, I did my videos talking about the side effects. And of course, at that stage, there weren't too many at all. However, things did change because over the following weekend, so that was the Friday, the Saturday and Sunday, I started to feel really bad. I was bringing up blood and mucus and feeling terrible. So much so that on the Monday morning, I rang up the specialist oncology nurse and chatted to her. Now, when we were discussing the blood, the problem started because it's difficult to gauge how much blood was coming out. It looks fairly spectacular. In fact, what I'm going to do now is show you a picture of my bowel movement in the toilet pan. Now, if you don't want to look at stools and blood, then I'll recommend that when I let you know, you close your eyes and I'll let you know when you can open them again. So for those who don't want to watch blood and bowel movement, please shut your eyes now. Right, you can open them again now. Now, looking at that picture, I was judging a fair amount of blood. And when I told the nurse that, she said that could be a problem because if you are bleeding, that could be signs of bad news. And therefore, she recommended I went to A&E just to have it checked out. Well, that was the beginning of my problems because I decided to go. I got a friend to take me to the hospital. But of course, when I arrived there, it was heaving. It was mayhem. The queue came out of the door. There were over 100 people waiting to be seen. In fact, it took 5.5 hours to see a doctor. He was very good and patient, etc. Did a blood test and had a look at my rectum and decided the amount of blood wasn't a major problem. He diagnosed radiation proctitis, aggravated by being constipated, and sent me home. So the next day I rang up again the specialist nurse, and I have to say now they've been marvellous, patient, understanding, good advice. We chatted for a while. She made some recommendations and said she have a word with the doctor. And in fact, I got a phone call later on that day from the doctor who made a number of recommendations. One, she advised I change the laxative because the one I was using caused a lot of gas. And again, that's a major problem, which I'll talk about again in a minute. So I changed over. This is the one I went to. She also recommended that if things got really bad, I should try some treatment to soothe things, and that would be a steroid suppository. I'll talk about that again in a minute. So I carried on with the putting up with things. I was pretty in a lot of pain. In fact, I carried on for the rest of that week, and then decided I got to the stage where perhaps I needed to use the steroids. She'd already prescribed it, so it was just a matter of starting it. You can only take that for a maximum of 7 days. I decided to take them for 6 days just to be safe. And in fact, it made an enormous difference. They soothed things. It included a painkiller as well as a steroid. Use of suppositories is the first time I've ever used one, but in fact it turned out quite easy. And again, on YouTube, you can watch videos telling you how to use them. I won't give you a demonstration today. Just use one of the videos on YouTube if you need it. And after 6 days, the blood slowly disappeared and the pain had pretty well gone. I was then worried, of course, as soon as I stopped taking the steroids, that things would get bad again, because I know steroids are inclined to put things, suppress things rather than cure them. But in fact, over a week later, there's a little bit of pain, but not very much at all. The blood has disappeared. Things seem to have improved a lot. Also, by careful use of the laxative, I've managed to keep my bowel movement just about right, so I'm not either constipated or have diarrhea. So that I've got that managed pretty well. So I suppose the bottom line of this whole story is that with the care and attention and help from the oncology team, you'll get a list of phone numbers when you finish your treatment, people you can ring up to get advice. With all of their advice, things have cooled down. And I think it was rather silly of me at the end of my treatment to think that was going to be it, because most people do get some side effects. They stress all the way through that everyone is different. So you might have entirely different symptoms to me. But I think the bottom line is, do go through the treatment, because at the end of the day, this is going to be better than a cancer spreading around your body. And secondly, yes, there are possibly side effects, but these can be managed, and the oncology team is there to help you and see you through. So I'm feeling a month after my last treatment, I'm feeling pretty good now, and hopefully that's the end of my treatment. In a month's time from now, so in 27th of January, I'm seeing the doctor, the oncology doctor, to talk about results. By then I've done another PSA check. Don't forget, if you're a male over 50, you should make sure that you're having PSA blood checks. And then I think in February I'll have a scan just to see how things are going. Then this monitoring will carry on for 3 years, and hopefully that'll be the end of it, and I'll have survived prostate cancer. So for now I'm going to sign off, and my message is there's always people there to help you. So make sure you go through everything and take their recommendations and their advice, and you'll come out of it smiling. Thanks everyone for watching, and apologies for that photograph of my bowel movement.